Hyperbaric oxygen is basically using oxygen under pressure as a drug. We don't really think of oxygen as a drug, but in this case, it's a very powerful and wonderful drug. When we use hyperbaric oxygen, we are dissolving oxygen into the blood's plasma so that we don't even need to use our own red blood cells. The oxygen under pressure will dissolve and we breathe it in and it will circulate throughout the body without even needing red blood cells. Sort of like when you put pressure, you put carbon dioxide into a soda can, In the
simplest terms, what is hyperbaric oxygen therapy?
Hyperbaric oxygen therapy is the use of oxygen under pressure as a drug. We don't usually think of oxygen as a drug, but in the way that we deliver it with a hyperbaric oxygen machine, we are able to dissolve oxygen in the bloodstream so it gets to everywhere where red blood cells can't necessarily get, such as injured tissues or stroke areas in the brain. You don't need red blood cells to get there. We don't need to rely on stable blood vessels anymore. We rely on oxygen that is now dissolved completely in high levels in the blood's plasma without red blood cell necessity. So how does oxygen get into the bloodstream, and why don't we need red blood cells anymore? Well, what happens is oxygen or any gas under pressure will dissolve inside a solution. So think about a soda. It starts out as a regular can of flavored water, and we use a carbon dioxide cartridge and we push pressure into that solution to create bubbles. And that makes it a carbonated beverage. But what happens is really the gas that you're putting in there is dissolving into that solution because it's under pressure. And that's exactly what happens inside a hyperbaric oxygen machine. So we use 100% oxygen today because we found that it has really tremendous healing properties. But when we're inside a chamber with hyperbaric oxygen and we bring this chamber to low, so we use the chamber to bring us to a depth of approximately 33 feet underwater. And what that does is while we breathe in that oxygen, our lungs bring it in and then that oxygen will dissolve in our bloodstream. Usually we have to rely on red blood cells to carry oxygen. And that becomes a limit, right? It's limited by how many red blood cells you have. And it's also limited in its delivery to where blood vessels can actually go. So if it's dissolved in the plasma, you don't need to rely on red blood cells anymore, and you don't need to rely on blood vessels. So if you have severely damaged tissue, oxygen is going to get there, regardless of the status of the injury or the blockage that's going on, perhaps in a brain or in a leg. You don't need to rely on those blood vessels anymore. So it's really amazing the incredible depth and amount of oxygen that can really flush into your body. And it, under pressure, becomes much higher oxygen levels in all of the tissues in your body. Not just injured tissues, but all of your tissues. Air under pressure has been a concept since the 1600s, believe it or not. And that's because oxygen itself wasn't even discovered until 1775. But it was found that air, just regular air under pressure, had positive effects on certain illnesses. And there's a really fun history that goes along with that. But as hyperbaric has evolved and has this discovery of 100% oxygen and the reasons why people needed to have hyperbaric oxygen therapy have given us this combination of oxygen, 100% oxygen with pressure to have these final effects that are so beneficial.
What conditions is hyperbaric oxygen best suited for?
That's a lot. There's a lot of conditions. So,
what are the most common conditions that you use hyperbaric oxygen therapy for?
So do we talk about humans?
Why don't we just say it's been used for decades in human medicine and it's recently come to...
It's always been used in animals for decades too, just not as much.
So
we're bringing it to light. We're bringing it back, basically, and we're using it more and more today as It's been, reborn or resurfaced as a really excellent treatment.
Great. And then some of the conditions that it's best suited to.
Hyperbaric oxygen has been used in human medicine for many, many years. And guess what? They learned much of what they learned from animals. So we've known for a very long time that it will be very successful used in animals as well. And lately, we've brought this back to using in animals. Probably hyperbaric oxygen has been used in human medicine for many, many years. And there was a time where there wasn't enough evidence and people didn't believe in it, but it's really come back now with lots of scientific evidence, so much, thousands and thousands of pages of paper. Hyperbaric oxygen has been used in human medicine for many, many years, and it's also now being used tremendously in veterinary medicine. It's always been helpful, but hasn't always taken off well because it's very hard to scientifically prove its effects. And in this case, we have a lot of reports where the proof is in the pudding. We may not be able to have scientific data because no two cases are the same. Hyperbaric oxygen has been used in humans for many, many years. As we talked about, even in the 1860s, they started using pressurized air. The need for oxygenated oxygen under pressure really came to light when they were building bridges. And they were finding that people that were building very deep under the earth, when they came up, became very, very sick. And the solution to that was bringing a chamber that had high pressure oxygen in it to bring these people to reverse their symptoms and then bring them up very slowly from depth. And that is really where the primary uses for hyperbaric oxygen started in large amounts. And the Navy had a lot to do with it. And a lot of the human Navy officers really risk their lives to help us figure out what the safe levels are and how oxygen and nitrogen dissolve in our systems and how we can come up from pressure safely. We have found that using hyperbaric oxygen in animals is just as effective, if not more so. In human medicine, they're limited in the United States by what Medicare and Medicaid will pay for as far as treatments. So the Medicare and Medicaid have accepted hyperbaric oxygen as a good treatment for at least 14 designated uses. But we have found that there are so many more. And in hyperbaric oxygen in animals, we're really not limited by insurance companies or other things, so we're able to do much more without limitations. And we have found really amazing results. Some of the main reasons we use hyperbaric oxygen is because it's going to decrease swelling and edema. And edema is swelling in the tissues. So when you have an injury where oxygen is not able to get to the tissue effectively, or even just any injury at all, as you can imagine, sorry, I got distracted.
Do you want to bring the dog in so he's sitting there with you while we're...
That's good.
Oh, they're gonna finish that.
Yeah, we'll finish, yeah, but... Oh, baby, hi.
To add the dog.
I was
in the
just thinking
video-
it might make it a...
Yes, much.
There are many instances today where people don't believe that hyperbaric oxygen works. They say it's not scientific. But believe it or not, there are thousands and thousands, tens of thousands of studies that document the positive effects and any effect of hyperbaric oxygen. So there is significant amount of scientific evidence, and it correlates to what we find clinically in our patients. Because of the many effects of hyperbaric oxygen, we can treat many, many conditions. It's not meant to necessarily be a cure for certain conditions, but is absolutely helpful as an adjunct or in addition to normal medical treatment for some, forget that. Because of the effects of hyperbaric oxygen, we can treat an enormous number of problems. If we think about it, just reducing swelling alone has such a huge impact on healing itself, and it decreases pain. Imagine a dog that has had a disc injury to their back. It's extremely painful, and it's painful because of the massive swelling that happens in the spinal cord. If we can address that swelling very quickly by getting them in a hyperbaric oxygen chamber early, we can decrease that swelling quickly and prevent the changes and the severe damage that comes from disc herniation in our pets. We see tremendous improvement quickly. The sooner we address it, typically the better. But even after long-term injury and even after surgeries, we find that hyperbaric oxygen improves their healing tremendously. In certain parts of the country, snake bites are a very big problem and typically require antidotes such as antivenin for the snake bite, but that's not always possible. And sometimes we don't know if a pet's been bitten by a snake. but the severe inflammation and pain that is caused by a snake bite and the toxins that the snake releases is extremely devastating and can be deadly for our pets. The use of hyperbaric oxygen in a snake bite is so helpful that we don't necessarily need to use antivenin because the hyperbaric oxygen will act against the toxins that are released. It will quickly decrease the swelling associated with the snake bite and the toxins that are caused by the snake bite and prevent further damage to the tissues. And they heal so well. It's a godsend to snake bite patients, even spider bites and other types of inflammatory issues. Think about any type of injury where oxygen cannot successfully get to that area to heal a problem. For instance, a stroke. What is a stroke? A stroke is a lack of oxygen for one reason or another getting to brain tissue. So that causes swelling in the brain and makes the problem worse. If we have hyperbaric oxygen, we can immediately decrease that swelling, and we can also get oxygen to those damaged tissues immediately to prevent further damage and start healing immediately. One of the wonderful things about hyperbaric oxygen has been proven to increase your body's stem cell production. And stem cells are cells that are in your body that help differentiate into tissues like bone or soft tissue or blood vessels, so they end up getting differentiated into tissues that we need to grow. With hyperbaric oxygen and injuries, if we have increase in stem cell production, then we have more rapid healing. We have more cells available to turn into bone cells, to turn into blood vessel cells, and to turn into skin cells so that we can have more rapid healing. Nerve damage is often caused by inflammation or constriction of In many injuries, nerves become damaged. In injuries such as a crush injury where a limb is crushed severely, or where a leg is so swollen that the nerve becomes affected, or even central nervous system swelling, like in the brain and in the spinal cord. And we find that using hyperbaric oxygen is extremely helpful to decrease that inflammation and to promote healing in those tissues much more quickly than we would have if we were not using hyperbaric oxygen. One of my favorite uses as an internal medicine specialist in veterinary medicine is in systemic diseases that cats and dogs get frequently. One of the main ones we see is called pancreatitis, or severe inflammation of the pancreas. Now, the pancreas is an organ that not only helps us control sugar when we eat and when it also helps us digest our food. Imagine if your pancreas becomes inflamed, those digestive enzymes can get released into the bloodstream rather than just go into the small intestine to help digest your food. And that becomes extremely painful, and that creates more and more inflammation as those enzymes are released, and it can be deadly. When we intervene with hyperbaric oxygen, we find that the healing and the decrease in inflammation is so substantial that the animals feel better much more quickly. And the devastating effects of pancreatitis don't happen to the extent that they would if they were not being given hyperbaric oxygen. That's one that I really, really enjoy treating. So as wonderful as we make hyperbaric oxygen seem, and it is really wonderful, we have to always keep in mind that it is not meant to be, in most cases, a treatment by itself. When we have medical problems, when we have surgical problems, we need to address wound healing at the same time medically, and we need to address these surgical problems, and we need to monitor our patients as if they weren't getting hyperbaric oxygen. But using it in conjunction with hyperbaric oxygen and normal medical therapy is very, very important. We never want to lose track of our patient and what's going on. So as much as we'll see hyperbaric be helpful, we can't forget to treat the whole picture at one time. In human medicine, we see hyperbaric oxygen, or we hear about it, used with diabetics and foot ulcerations. Diabetic wounds in humans are extremely difficult to treat, and hyperbaric oxygen has been shown to be extremely effective. It's equally effective in animals with severe wounds, burns or abrasions that won't heal, or very thick tissue damage, or even using grafts. It is extremely helpful in healing for all the reasons that we talked about earlier, with decreasing inflammation and increasing stem cell production to go to that area and help with healing, to decrease the likelihood of bacterial infection, and overall improvement in all the prostaglandins and all the things that our body produces to improve healing. You will see tremendous effects of hyperbaric oxygen when we're healing wounds. The one thing we can't forget is that wounds are not going to heal just by hyperbaric oxygen alone and need to be managed medically at the same time. One of the things that I always say in all of my talks and to everybody is a simple explanation of how hyperbaric oxygen works. It decreases the pressure from reducing the gas in tissues or cavities and reduces edema, which is swelling in tissues, and that results in less injury from vascular compromise, and it decreases bacterial translocation, meaning we're not going to have bacteria getting into our body or making us septic, or we're less likely to. It decreases cell death or necrosis, and it decreases pain and swelling. If it only decreased pain, how helpful would it be? But if we have an animal that's just had orthopedic surgery, and we know that much of their pain is from swelling, we can use hyperbaric oxygen to quickly decrease that swelling and decrease the pain and help healing start just from there.
Kippur was presented to us by an organization that saves greyhound dogs that are veterans of a racetrack. He broke his leg a few months ago, had a couple of surgeries, and was not healing well. He suffered from basically a severe bone infection, muscles infection, and some skin lesions that were extremely unpleasant for him and really harmed him and his ability to live a happy life. So when we saw him, we staged the treatment, and we had a plan for him. And that plan included hyperbaric oxygen therapy. So he would be a good candidate. We thought he would be a great candidate for hyperbaric oxygen therapy because he pretty much checks most of the boxes.
Right. I think that he's an excellent candidate. And I think this is a really good way of showing how important it is to have a primary doctor not only manage him with hyperbaric oxygen, but also with good medicine and wound healing medicine, and addressing this as more than just a hyperbaric oxygen patient, but a wound management patient. So if we look at him, we know that he's got severe infection in the bone. And we also know that hyperbaric oxygen is going to kill the bacteria that are living there. And it'll also enhance the effects of any antibiotics. So they've done a culture of this area. They know exactly what organism is really causing, or bacterial organism is really causing the problem. So in using the correct antibiotics as well as hyperbaric oxygen, that's going to really help the bone infection by itself. Additionally, there's a skin infection and there's local muscle damage, and he's very lame because he can't step on that. So he's not using that leg as much. So remember, we talked about that stem cells become mobilized. So now we can have improvement in the muscle of the leg that he's not using well, so we can help repair that muscle as he gets better. And it's also going to affect the bones and help the bones heal better and decrease the swelling, decrease the pain. And that's really what we want for him.
Exactly. And we're planning ahead to have what we hope to be his very last surgery. We're gonna put him in the chamber for a few sessions prior to that surgery. That's gonna take place in a few days' time. And then after that surgery, we're gonna apply a few more hyperbaric sessions, and hopefully will help him heal completely.
Yeah, so Dr. Kesselman brings up another really good point, that hyperbaric oxygen can be helpful prior to a surgery. And this happens a lot in human medicine as well, is that it's going to prime the tissue. It's going to make those stem cells move. It's going to get them ready to do what they need to do as far as healing afterwards. But it's also going to help promote blood vessel production. And so, although we don't need blood vessels for hyperbaric oxygen itself, we do need them afterwards. And we need to help bring in new blood vessels to continue healing when hyperbaric oxygen is finished.
He's a great candidate. He has this calm demeanor. He loves the chamber. He loves everything about being treated. But I bet he doesn't love the pain and the suffering involved in his bone being challenged like that. So hopefully we're going to do right by him.
I'm sure you will. And I have a lot of people ask, do they need to be sedated when they get put inside a chamber?
That depends. The vast majority of dogs do not need to be, and cats don't need any sedation. And
I find
any
that
help.
as well.
Yeah, it's a calm environment. It's a clean and quiet environment. We induce the whole atmosphere to help them feel secured. We offer the pet owner to be sitting basically with them and see their pet through the windows. And but in a case that we need to help them be calmer, we do have the means to do so. So light sedation is not out of the realm of possibilities, but most cases it's not required.
Yeah, I agree. That's been my experience as well. Well, I think we have a really great chance of helping you, little man.
Yeah.
And I'm looking forward to seeing you get better. Yeah. Maybe we can help his teeth. Oh, God, a greyhound with good teeth?
Yeah.
I've never seen that.
Yeah. Scale them. All right.
Excellent.
Thank
That
you.
was great.
That was
Great
awesome.
Good
dialogue.
job.
So, do you think, is there anything that we haven't?
You know, Dr. Kesselman, I find that a lot of people are calling and wondering if these treatments are appropriate for their pet. And I think cancer may be one of the most important calls I get, with people really wishing for that solution to their pet's cancer. What have you found in using it for cancer?
That's a hard call. I truly think there's not enough evidence about it helping cancer patients all the way. The virtues with which we work to actually try and improve the well-being of cancer patients is knowing for a fact that it would decrease inflammation, decrease pain, and help via those notions. But other than that, there's no real evidence that it would cure cancer.
I agree with you. I know that there are some studies using ketogenic diets, and combination with hyperbaric oxygen in people has been quite successful. But I also feel that, I'm sorry, it's so noisy out there.
Yeah.
Are you hearing that?
Excuse me, we shooting actually. Sorry about that. Yeah. Okay.
So where were we?
Ketogenic.
I'll just start that I agree
Yeah.
with you.
Yeah.
I agree with you completely. I find that people are really looking for that answer for their pet, and we need to be very responsible with giving, realistic expectations. But there are some instances in human medicine where they've found that ketogenic diets along with hyperbaric oxygen could be helpful, but we still don't have enough evidence, or it's not being done enough in veterinary medicine yet. And maybe in the future we'll find that that's a great solution. But I agree, being able to decrease the symptoms of pain or skin lesions or radiation burns that have happened, the post problems with hyperbaric. But I also find that good thing is they don't get worse. So there are certain situations where we wouldn't use necessarily hyperbaric oxygen for the tumor itself, but maybe for something else that's going on in the patient. And I have found that they don't worsen, and it really doesn't seem to affect their lifespan in a negative way.
True.
And may actually improve it, but it's very hard to tell that.
True. And considering the issue with life quality, I mean, when our pet's sick and they cannot run and be happy, that's what at times would determine the outcome. Hyperbaric puts them back on track, even when they carry the disease, or a disease like cancer or some specific types of cancer. When the hyperbaric renders them playful, that's a huge asset, and it's precious.
I agree completely.
Yeah.
I find it really fun to treat things that maybe people would not have thought of in the past. So we didn't have the options. We have some very, very resistant infections that can happen that are only treatable with some type of dangerous medications, or we deem them dangerous. Obviously, when they're used properly, they're not necessarily dangerous, but it's amazing how the hyperbaric oxygen can actually decrease the inflammation associated with like a urinary tract infection. So the bladder is less painful, and the antibiotics have increased activity when they're being used under hyperbaric pressure. So I find that really fun, and sometimes we get rid of infections without using antibiotics. What's your experience?
Oh, absolutely. I agree. I totally agree. At times, first of all, we know for a fact it potentiates antibiotics, the effect of antibiotics or virtually any other drug out there. And when we treat urinary tract infections, some of them unfortunately require surgical intervention. For example, when we need to create a new urinary outflow tract in a cat, and that involves healing time, pain, discomfort. Granted, it's a life-saving procedure, but it does require some preparation. The hyperbaric done prior to the surgery and then post-op gives us excellent results. We get to work on a tissue that's significantly less irritated, and we get the cats to heal in a fast pace that we never experienced before. So I think with that regards, it definitely does the job. It's hard to guarantee, like with any other disease that we treat, but we definitely see results that are promising.
Yeah, thinking about it, preoperative or preemptive hyperbaric oxygen can help in so many situations, right? So imagine the swelling around a bone fracture. Bring that down, work with healthy tissue. The urinary bladder, what an easier tissue to work on when it's not inflamed.
Yeah.
It's much more reliable results, and it's decreasing the pain right away.
Exactly.
So sometimes I find we decrease the pain so much that people think everything's fine and they don't need to have surgery. But we have to remind them of why and how helpful it is. How long do you find these effects last in your patients?
I would say for a few days. So that depends on which brings the question of so how many treatments would you recommend? We usually go with session of about 5 treatments because we would like to basically eliminate the disease process. We would like to eliminate the inflammation and the infection. So I would say a good time for it to hold its effect will be 2-3 days, but I don't take it for granted. I have to say that we recommend sessions that are in high frequency, so 5 sessions, maybe a session a day, but then we see better results that last longer.
Yes, I agree. I find that as well. And sometimes if they're very acute, meaning the disease just happened, I find that getting to them as quickly as possible is usually results in the best outcome.
Yeah.
So I worry sometimes patients wait or referring doctors will wait to send a case as if it's the last thing they do. And I hope in the near future they'll think of it as the first thing they do,
Yeah.
rather than the last thing they do, because we'll see so much more success. Although it is truly amazing in chronic cases where they still respond extremely well, but I find that takes longer or more treatments the more chronic a problem is.
Yeah.
Is that your experience?
It's my experience, absolutely. It's not a one-stop shop, though.
Right.
I mean, this is an added treatment module to treatment that's already happening. Rarely do we just treat with hyperbaric, but it definitely puts most other treatments on a complete different level of success in our experience.
One thing I find is that we get a lot of people calling to help their pet in one way or another and hoping that hyperbaric oxygen is the solution for them. But as you and I both know, it's not appropriate for everything. It's not the panacea for all diseases. And we have to really pick and choose our clients carefully, our patients carefully. What do you find is the least helpful for hyperbaric oxygen?
Yeah, that's absolutely a key point. Patient selection is one of the major points that we emphasize. We need to know which patient we're treating. The cases with which hyperbaric probably won't be the solution. Number one, obviously, are the contraindicated patients. Contraindicated patient will be a patient with thoracic cavity injury, that might harm the lungs. We cannot challenge those patients inside the hyperbaric chamber. Other patients are patients with inner ear trauma or inner ear tumors, inner ear infections that are devastating enough to the tympanic membrane. These patients would not feel comfortable inside the chamber. So patient selection, like everything in medicine and surgery, patient selection is key. Expectations are key. While we're happy to see the improvements in so many aspects of veterinary medicine and surgery, we still have to be extremely mindful with which patients we put in the chamber. We need to do a bit of a workup, diagnostic workup, and make sure this is safe for our pets. And that's what we encourage people to do.
That's what makes me so happy about helping you guys promote this in this area. First of all, being the first hyperbaric chamber for animals in all of Canada is surprising, but it's fantastic. And so I hope that more people will get the experience that you're providing, and it will become more popular. The one thing that I like the most is that you really are very, very conscious and very careful in selecting your patients, and very mindful of who should go in and who shouldn't go in, and making people aware of exactly what to expect as far as you know, and what not to expect, which I think makes you the perfect person to be pioneering this in this region.
Thank you. It's a whole team around me, but yeah, we really took it as a goal to implement that treatment module.
You guys have done a fabulous job, so
Thank you.
I'm looking forward to sharing lots of success stories with
Thank
you.
So this is the hyperbaric oxygen chamber. What we have here behind this wall is banks of oxygen canisters that supply the oxygen via these pipes. This is our these are our indicators for pressure inside, outside, and in the canisters, inside the chamber, in the canisters, and outside. We actually regulate the chamber activity with those indicators. This is the chamber, some windows, so we can see what's going on inside. There is also a very good monitor here that allows us to really observe any pet that's in there. We can actually see respiration pattern and level of comfort. The chamber itself, is fairly simple. So there's enough space inside to put very large dogs, including Great Danes, inside of it in actually great comfort. Once it's closed and sealed, it's ready to be compressed and the treatment starts.